Hello everyone, I am Dr. Nisha Bhatnagar, Medical Director at Avaya Fertility and IVF Center. Welcome back to our YouTube channel. Today I am going to be busting a few myths about infertility. The purpose of this talk is to provide you with sufficient evidence-based research and information from the experts. So let's talk about the first myth. We have commonly heard that females in their early 20s only can get pregnant, or in their early 30s can get pregnant. It is very difficult to get pregnant later on. Though to some extent this is true, but you also need to remember that fertility is a very individual thing. It may be true for some females, it may be true for generally that it is difficult to get pregnant in your late 30s, but unless and until you have checked yourself, you don't know which category you belong to. There are certain females who may get pregnant very easily in their late 30s also. However, there might be certain females who are struggling to get pregnant in even their late 20s. So don't get pressurized or stressed by this general statement that it is difficult to get pregnant later on. It is true to some extent, but find out where you stand. What is your present status? What is your future fertility prospect? Don't get stressed otherwise. So the second commonest myth which people think is that infertility is a female problem. So that is nothing but a myth, because infertility is a complex problem. Most of the cases it has multiple contributing factors. It can be age, it can be female, it can be male, it can be combined, it can be unexplained. So only female is responsible? No, that's not true. In the last few decades, we have seen increasing trend in male infertility. We have seen increasing incidence of male infertility to the extent that WHO has to change the definition of a normal semen analysis. So no, female is not only responsible, you need to, both partners are equally responsible. This could be male problem, this could be female problem, this could be a combined factor, this could be a multifactorial thing, or this could be just unexplained. Remember, when we are not talking about a male or a female here, we are talking about an embryo which is formed by contribution from both the partners. Sometimes it is seen that egg is good, sperm is good, but still we don't get a good embryo. Sometimes it is seen that a good egg can compensate for a bad sperm, or a good sperm can compensate to some extent for a bad egg. So please remember that it is a combination of two partners. It is never only one partner responsible for infertility. So the third commonest myth is that birth control pills reduce fertility. Again, that is not true. Birth control pills are hormonal pills which are given to balance your hormones. We use the birth control pills a lot during the treatment of infertility. Remember, fertility or ovulation is it's a complex interplay of hormones where some hormones rise and fall, other hormones rise and fall, and they do it in a synchronized manner. When we give you OC pills or oral contraceptive pills, actually there is a consistent low level of both the hormones available in the body. So this consistent low level of hormones sort of balances the hormones. If there is some kind of hormonal imbalance, this balances it out. So no, OC pills don't reduce your fertility. And also remember that most of the times, even if you have used OC pills for a very long duration, as soon as you stop it, in the next cycle, that fertility is regained back. It is again, you are again back to your normal status. It cannot contribute to infertility. So please don't hesitate. If it has been prescribed to you, please don't hesitate in taking it. Another thing is secondary infertility. Sometimes people think that if they have one child, it is like everything is nice and they are going to have a second baby on their own. And sometimes because of this misconception, they lose on valuable time. So secondary infertility is a fact. Secondary infertility is a very, very real thing. There are people who have had one child but later on they have problem in conceiving. There could be different contributing factors to that. If it is a difficult childbirth, there may be infection or damage to the tube which can lead to secondary infertility. Also remember that you had your first child when you were young. Now you are old. Lots of things change. Your AMH change, your antral follicle count change, your quality of egg change, your sperm fat parameter change, the stress level has increased, all the hormone parameters have changed. So please don't think that if you have had one child, you are going to have the second one on its own. If you have given enough time, if you have tried for 6 months to 1 year and you are not able to conceive, it is recommended that you go and meet your doctor and get yourself checked. Please remember, secondary infertility is a real thing. If there is any problem, you might need help of assisted reproductive technologies like IUI or IVF to help conceive you with that second child. Please don't lose on valuable time just thinking that because you have had one child, the second is gonna happen on its own. Last but not the least, we always heard that a man's fertility never declines. Again, this is nothing but a myth. Nowadays, we have seen there is an increased incidence of infertility even in males. The count, the motility, the morphology, all these parameters have changed. There is an entity called severe oligoasthenoteratospermia, means the count is less, the motility is less, the morphology is bad, and the sperms are not as they should be. They are not meeting the WHO normal criteria. So if you have tried enough and you are not getting pregnant, there is no harm in getting your semen analysis done. Also please remember, earlier it was thought that a male doesn't get old. There is a female thing which is called female menopause, but males do not have the menopause. Let me remind you that this is also not true. There is a true entity called male menopause. Also we need to remember that with aging, there is a lot of structural and genetic changes happening in the males also. There are genetic changes happening in the DNA of the sperm. Of the DNA fragmentation is increased. The damage of free radicals, pollution, stress, and all that can affect the sperm count and motility. So please don't think that males cannot get old or there is nothing called no male infertility. No, males can also have changes with age in the sperm count, motility and morphology. So please get yourself checked if you are trying to get pregnant and not getting pregnant. If you have any more questions regarding this, or you want to know or clear any other myth, please feel free to contact us at the given numbers. Thank you so much.